What are the best barrier methods for sex health? When it comes to sex health, understanding barrier methods is essential. These methods help prevent pregnancy and can also reduce the risk of sexually transmitted infections. Let's explore the best options available. First up are male condoms. These are thin sheaths made from materials like latex, polyurethane, or polyisoprene. They cover the penis during intercourse and are widely recognized for their effectiveness. Male condoms not only help prevent pregnancy but are also the only barrier method that significantly reduces the risk of many sexually transmitted infections, including HIV. They have a typical use failure rate of about 13% for pregnancy prevention. You can easily find them at pharmacies or grocery stores, making them a convenient choice for many. Next, we have female condoms. These are pouches made from polyurethane or nitrile that are inserted into the vagina before sex. They act as a barrier to sperm and can also help reduce the risk of sexually transmitted infections. Female condoms can be inserted up to 8 hours before intercourse, and they have a typical use failure rate of around 21%. Although they are less commonly used than male condoms, they offer a valuable alternative, especially for those who may have latex allergies. Diaphragms are another option. This shallow, dome-shaped cup is made from silicone or latex and is inserted into the vagina to cover the cervix. To be effective, diaphragms must be used with spermicide, which increases their effectiveness to about 87% with typical use. However, they do not provide protection against sexually transmitted infections, so they are not recommended as a primary method for infection prevention. A healthcare provider must fit diaphragms, and they requiring a prescription. Cervical caps are similar to diaphragms but smaller. They fit tightly over the cervix and also requiring spermicide for effectiveness. With typical use, cervical caps are about 78% effective. Like diaphragms, they do not protect against sexually transmitted infections and must be fitted by a healthcare professional. Spermicides are another barrier method. These chemical agents kill or immobilize sperm and come in various forms, including foam, cream, gel, film, suppository, or tablet. When used alone, spermicides have a typical use failure rate of about 21% and do not provide any protection against sexually transmitted infections. They are often used in combination with diaphragms or cervical caps to enhance contraceptive effectiveness. Lastly, we have contraceptive sponges. These small, round devices contain spermicide and are placed inside the vagina to cover the cervix. They provide both a physical and chemical barrier, with a typical use effectiveness ranging from 73% to 86%. However, like other methods, they do not protect against sexually transmitted infections. For effective sex health, male condoms stand out as the most reliable barrier method. They provide dual protection against pregnancy and sexually transmitted infections. Female condoms offer a good alternative, while diaphragms, cervical caps, and spermicides should ideally be used alongside condoms for better protection against infections. Always remember that using these methods correctly every time during sexual activity is crucial for their effectiveness. If a barrier method fails, consider consulting a healthcare provider about emergency contraception and testing for sexually transmitted infections. In summary, the best barrier methods for sex health balance pregnancy prevention with protection against sexually transmitted infections. Male condoms are the gold standard due to their accessibility and effectiveness. Always consult healthcare professionals for personalized advice tailored to your individual health needs and sexual practices.